I'm joined by Dr. Stephen Stair, UAB doctor and associate professor of internal medicine, but also a longtime member here at Homewood and a friend of all of ours. And so, Dr. Stair, thanks for being with us. And just wanted to talk through a few questions with Dr. Stair from his perspective on our reentry process. And so, Dr. Stair, if you can start off just giving us an update just on where we are in terms of COVID cases locally, and also why it's important to continue just to pay attention to these numbers moving forward.
Sure. Thank you, Brett. I want to reiterate, I'm here as a church family member and really am not representing UAB officially, but I do live it every day, and you'd have to live under a rock to know that it's been a pretty rough month. We are seeing cases rising significantly, and I do have a slide if you want to take a look. You can see the first part of June, cases were, and this is for our general kind of service area around Jefferson County, cases were below 50 June 1st. And as you see, the month has gone on, the Memorial Day weekend, everything opening back up. If you look at the next slide, we hit a high yesterday of 906 cases. At our hospital at UAB, we have a record number of patients in the hospital. We have 30 or so patients on the ventilator. We are seeing, fortunately, the death rate not really increase yet because there have been some really good, I think some good practices by our vulnerable population to stay home, to stay in masks, to use hand sanitizer, and to stay distant from others. So we're not seeing as many patients on the ventilator, but we are seeing a lot of sick patients. And I will say, even as a young, healthy person, you don't want to get this virus. The chances are relatively good that you'll be okay. In fact, more than 50% of folks are asymptomatic, don't have any symptoms. But it's a little bit of Russian roulette. People do get sick from this virus who are healthy. Now, of course, we focus on the vulnerable population, the patients over 65, people with chronic medical conditions like cardiovascular disease, kidney disease, diabetes, cancer, anyone who's immunosuppressed at all. Those are the highest risk patients. So let's take a look also at the third slide, which shows the risk areas that we're seeing in the state. And the red is very high risk, which means cases are increasing or stabilizing, staying the same. You can see that Shelby County, a lot of us are from Shelby County, is in the very high risk category. Jefferson County is in the high risk category, which means that cases may be starting to improve, but not significantly. So this is just kind of setting the stage for us to understand that we have a record number of cases right now compared to where we were in March and April.
So obviously it's important for us to think about personal responsibility, as we re-enter into in-person gatherings. And so what are some of the questions that, we need to be asking ourselves, before we, come back to the building?
Yeah, without a doubt, we can limit the spread of this virus with practices that we do. The first is, if you're in the vulnerable population, worship from home. Patients over 65, patients with the chronic conditions that I mentioned, that is of critical importance. Cannot stress that enough. For others, for all others, it's wearing a mask. As you know, as of Monday, we have a mandate in Jefferson County to wear a mask in all public places. Now, if you read the fine print, worship assemblies are excluded from that mandate, but the wording is very particular. It is strongly recommended that we wear a mask in worship services as well. So we know that that limits the spread because it reduces the chance that we have of coughing, sneezing, even talking, spreading it to others if we're close. Hand sanitizers and hand washing is extremely important as well. I know we're planning on having that very much available when the time comes that we come back to worship. And then the socially distant, the 6 foot of social distance, I think, has been shown as well. To decrease the spread. So really those are the primary things that we're focusing on here, as you know, with our planning, and that we need everybody at Homewood and everybody listening to understand and take that responsibility that if you're in the category that I mentioned, you really need to worship from home to reduce your risk. If you're not and you come, wear a mask at all times, stay distant from each other. You can talk to each other from a 6-foot distance with a mask. I think that's fine. And wash your hands as much as you can.
Yeah, so personal responsibility, reflecting on those questions before you come. Am I in one of these categories? And these are tough questions to ask as a church family, obviously, because, we're a multi-generational church
Right.
family, and we love one another. And so when we have to ask some of these questions, it can be difficult. But as we enter into stage 3 of our reentry process, we've made the decision to hold off having classes, having nursery and children's worship. Why would you say that that's important for the time being?
Well, of course, those are going to be enclosed spaces for the most part. There's going to be a lot of togetherness. You cannot keep children 6 feet apart, obviously. And although this virus has very, very little risk to children, fortunately, we really don't know the extent that they can spread it to others. And so I think the recommendations of staying away from nurseries and classes is a very good one. We need to mention, too, the recommendation in Jefferson County is children 3 and over wear masks. And, that's something we're really going to try hard to follow at Homewood as well. That's not going to be possible 100% of the time, but that is something that I think we need to be aware of as well. And it's not for them as much as it is to protect others that are here as well. I do want to mention, too, the positivity rate right now in Alabama is 10.2%. So if you're asymptomatic and you get tested, you still have a 10% chance of having this virus. And so when we talk about masks, we're talking about, and I mentioned this when we got together a couple of months ago, think of yourself as having the virus. Think of yourself as walking around with the virus. What can I do to reduce that potential to spread it to someone else here?
Yeah. Yeah, it seems like it's been a long journey since you were on this stage back in March, and here we are over 3 months later, still having these conversations, learned some things, but we're still desiring to be safe in the way that we reenter and to show, love of neighbor to everyone. So
That's right.
I want to thank you for walking alongside us in this process and, continuing to offer your medical expertise in the way that we make decisions. But anything else that you would add before we leave?
Yeah, I think it's important to talk about singing a little bit. Singing is a huge part of what we do here. And singing with a mask is challenging for all of us, but we can still do it. I don't think you want to just sing out boisterously and start inhaling that carbon dioxide, back in. Having some really good talks with Kevin about what the praise team and how they're going to handle things. I think it's going to be a great job, and I can't stress how much I've admired and appreciated the work that they've done through this last 3 months as well. They've really worked hard and have really helped us to get through this. So we are working hard on the best way to make that work, and I think it will. But we do ask you to sing, but maybe not sing to the full extent that you like to, just because singing does increase that distance, we know. And then something else is visiting out in the lobby. One of the things we do at Homewood, as I mentioned, I don't think there's a problem with visiting from a distance. I think the leadership group is working on a plan for how we kind of move ourselves through the worship service and how we move out. But a big part of what we do is loving, connecting, and serving, and that involves connecting with each other. So we do want to keep that in mind, but we do also want to be sure that we're, again, thinking about ourselves as how can I protect someone else at all times.
Well, Dr. Stair, thank you for being with us and for sharing some of your thoughts, and we do look forward to gathering as soon as possible.